This is a pace that no one, in healthcare at least, has experienced in their professional lives. My team is good. I've broken my team into teams of 4 with 4 people in the building at all times, and they rotate in every 4th day. I rotate in every 3rd day, and there's always someone on call 24 hours a day, and so we're present, and there's a lot of moving pieces, and when we're not here, we're working remotely, and we're trying to do our part to social distance as well, so we can't all be locked in the same space for hour after hour, day after day. So, we do run a 7-day-a-week operation, and so we're used to that, but this is a different way in which my team is working. So I describe physical distancing or social distancing as increasing the physical space between individuals to cut down the spread of any kind of illness or, respiratory illness. So you increase your physical distance from people 6 feet. So if you have a sleepover with somebody, you're not increasing their physical distance by 6 feet. And it's all of these things together. It's physical and social distancing. It's staying at home. It's keeping your home clean. It's washing your hands. All of these things together will help in what we talk about in healthcare is flattening the curve. And by flattening the curve, you don't spike the number of people that are impacted by COVID so that you don't overwhelm the healthcare system. And that's why you social distance. That's why you disinfect your house. That's why you keep your family home and in the house. And, I often think about it's crazy. My children are grown. I can't imagine being at home with a bunch of little kids and trying to entertain them and work from home. Many people are, but it's important right now if you really want to help the healthcare system. I think this is a long game, and I think you're in it for a long time. And people ask me all the time, well, when will it be done? I wish that I could do that. I've never planned for something in leadership. You plan with the end in mind. And, there's no end to this, so it's very hard to plan. But the weather is spectacular right now. It's sunny. You just feel like it's just a normal, beautiful spring in Pennsylvania. But if you want to not overwhelm the healthcare system, you have to stay put. You have to respect it. And we can't see it, but you have to, everyone watches the TV. I mean, see what it's doing in other places and where you've seen the flattening of the curve. For instance, in Los Angeles or San Francisco, it works. They're not overwhelmed. And in other parts of the world where they've done it proactively, they have not been as devastated by COVID as in other places. And so it's so important. And it's your social responsibility, but it is also your moral responsibility, I believe, to honor social distancing and just be patient. Just stay home, and someday we'll have the opportunity to look back. But for now, it's your responsibility, and you owe it to your friends and neighbors and to those around you to just social distance and stay home.